Our study is on the influence of probiotics on acute watery diarrhea. I'm Ashley.
I'm Laura.
And I'm Irene.
Probiotics are live microorganisms which are thought to be beneficial in numerous ways to the host organism that consumes them. For example, one claim is that probiotics can be used to treat acute watery diarrhea. These microorganisms can be found in many different fermented foods, such as milk and soy-based yogurts and some dietary supplements. The first scientist to propose using lactic acid bacteria for beneficial purposes was Eli Metchnikoff. Probiotics are sold in many different forms, such as pills, powders, drinks, and foods. Because of the many different ways these items are marketed, they are sold at a wide range of prices, from as low as 80 cents for a yogurt with live probiotic cultures, up to $35 for probiotic formulas. Because of the claims about the incredible benefits that probiotics have on the gastrointestinal system, the use of these microorganisms is on the rise. Probiotics work by forming a barrier that can prevent harmful bacteria and viruses from multiplying in the gastrointestinal tract. The barrier enhances the strength of the GI tract and their immune system. Some benefits these protective qualities have or can have for a host include decreasing the prevalence and severity of diarrhea, reducing inflammation of the GI tract, and relieving lactose intolerance. Acute diarrhea occurs when a person passes 3 or more loose stools in a 24-hour period for 3 or more weeks. Usually acute diarrhea is caused by infectious agents, bacterial toxins, and some drugs such as antacids and nutritional supplements containing magnesium. Also, many organisms can cause diarrhea such as viruses, bacteria, parasites, and certain fungi.
Prevalence. Worldwide, acute diarrhea constitutes a major cause of morbidity and mortality. It's especially common among the young, old, and sick. It's estimated that each year, U.S. adults experience 99 million episodes of acute diarrhea, about 8 million physician visits, and more than 250,000 hospital admissions, which is 1.5% of adult hospitalizations, are caused by acute diarrhea. Acute diarrheas are usually infectious in origin and resolve before diagnosis can be made. There's often presence of blood in the stool and abdominal pain or cramping. Other signs of volume depletion might include dry mucous membranes, decreased skin turgor, and confusion. The treatment for diarrhea is mostly fluid and electrolyte replacement and dietary modifications. People are often put on the brat diet, which includes bananas, rice, applesauce, and toast. Sometimes there's drug therapy. Good sources of probiotics are mostly dairy products, including yogurt, cheese, buttermilk, wheatgrass.
This is my study. The objective is to compare the efficacy of 5 probiotic preparations recommended to parents in the treatment of diarrhea in children. There were 571 infants studied. Excluded infants with chronic diseases. A normal dosage of 1 billion CFUs per dose were administered, diluted with 20 milliliters of water in lactose or cow's milk, and fed 2 times a day every 3 to 6 hours. This is a table of the duration of diarrhea in hours in the 6 different groups. And this is the number of samples in each group. Group 1 is the control group. The p-values show that group 2 and 5 are significant with a value of less than 0.001, which is the length of diarrhea shortened. This table, the median daily stool outputs is from day 1 to day 7 of probiotic administration. Group 2 and 5 are also significant with a low significant value from day 2 to 5. This is a significant drop in stool output. overall efficacy in group 2, the lactobacillus, and 5, the mixture of probiotics, is high. These strains work better than the other strains in decreasing the symptoms of acute diarrhea. And then a 95% confidence interval for the consistency of stool output, and a standard deviation of 30 hours for the duration of diarrhea.
The second study included 179 male infants ages 3 to 36 months old who were suffering from acute watery diarrhea for less than 48 hours. After the infants were rehydrated with the World Health Organization's oral rehydration solution, patients were randomly assigned to receive a milk formula either containing LGG or not for 5 days. 89 infants were assigned to receive a formula free of the LGG probiotic, and 90 received the formula which contained 1 billion CFUs per milliliter of LGG. The length of the study was 120 hours. Upon completion of the study, it was found that the infants receiving the LGG formula had a significantly larger stool output than the control group, but the duration of their diarrhea, the rate of treatment failure, and the proportion of patients with unresolved diarrhea after completing the study was not significantly different from the control group. Again, in the control group, the participants' stool output was significantly less than that of the LGG group, but no other significant differences between the two groups were found. Here you can see that of the 90 patients in the LGG group, only 52 had cessation of diarrhea. This is comparable to the 51 out of 89 control group participants whose diarrhea stopped by the end of day 5 of the study. In conclusion, the study found that LGG does not have a positive effect on the clinical course of acute watery diarrhea, though it did not appear to have any negative consequences. Though it is unknown whether or not these results can be generalizable to other cases of acute watery non-cholera type diarrhea.
Study 3 was a randomized clinical trial with 100 subjects ages 3 months to 10 years with acute watery diarrhea. Group A was the control group, and they received oral rehydration solution for 5 days, and Group B was the Aspelarti group, and they received oral rehydration plus Saccharomyces boulardii, 250 milligrams twice a day for 5 days. Exclusion criteria for the trial were a fever of greater than 38.5 degrees Celsius, clinically severe dehydration, blood in the stools, intake of antifungal drugs, or severe malnutrition. Diarrhea was defined as passing 3 or more loose stools per day. Diarrhea was considered to have stopped when the child passed less than 3 stools per day or stools with a solid consistency. On day 2, the control group, there were only 15 people, or 30%, had less than 3 stools per day. The Aspelarti group, 27 people had less than 3 stools per day, which is a p-value of 0.019. On day 3, in the control group, 12 people had stools of a normal consistency, and in the Aspelarti group, 38 people had stools with a normal consistency. The results were, in the control group, the mean duration of diarrhea was 4.68 days. In the Aspelarti group, the mean duration of diarrhea was 3.08 days. This is a table showing that the p-values were significant on days 3, 4, and 5, and there is a 95% confidence interval on days 3, 4, and 5. In conclusion, the Aspelarti shortened the duration of diarrhea and normalized the stool content and frequency.
This is our overall level of evidence, which we gave 3. There weren't many studies about probiotics in acute diarrhea. Our public health recommendation is the use of probiotics for a duration of longer than 2 days will decrease the severity and the duration of diarrhea. These are some additional information found contradicting probiotics. Probiotic safety has not been thoroughly studied scientifically. More information is needed on safety for all ages and the immunocompromised. Side effects are mild and digestive, gas or bloating, too much stimulation of the immune system, or gene transfer. Also, an infant with watery diarrhea should consume 4 ounces of yogurt with between 6 to 1 billion CFUs per dose of either a mixture of probiotics or LRSGG strain, which effectively decreases the duration and frequency of diarrhea. Any type of yogurt can be used because all contain probiotics.